Hi, my name is Dr. Wayne Hodges, and on behalf of my partner, Dr. Rick Duenas, and all our staff and therapists here at AV Health Associates, we want to welcome you to this introduction to our clinic. First, let me start off, just like every other doctor, people come to us to get rid of pain, increase their motion, and decrease the amount of muscle spasm and symptoms they have. And we want to help people do that as fast as we can. So we try to provide the fastest natural health restoration and pain relief that we can in the shortest period of time, so that you can get, number one, back to work, back to your family, and back to the things that you like to do that really are what quality of life is all about. So that's really what our main goal is. But many times the symptoms that people got are just the surface of many underlying conditions. For instance, it's not a lack of aspirin why you get a headache, or it's not a lack of high blood pressure medication why you get high blood pressure. There's underlying causes to problems that lead to those conditions, and then we treat them with different drugs or herbs or whatever, vitamins. People use all sorts of things to get rid of symptoms, okay? But we need to address symptoms, okay? But we need to address the underlying cause of the problem. So what we do is we concentrate on treating two primary conditions, okay? One is the primary structural condition, which is abnormal posture and movement. And when you have abnormal posture and movement over a long period of time, you'll develop tissue damage that will lead to many secondary conditions, such as headaches or disc problems, or degeneration or arthritis or carpal tunnel syndrome. I mean, a myriad of problems, okay? So when you come to us and you have these conditions, these are secondary to abnormal posture and movement. So our goal, yes, we want to help you with the symptoms from this, but we want to help really restore the underlying primary condition, which is abnormal posture and movement. Because if we can correct that, then we can decrease the recurrence of these secondary problems from occurring over and over again, and we can keep you from wearing down over a long period of time, okay? So this is the structural side. Then on the internal side, we treat the primary internal condition. What I mean by internal is more like your, organs, glands, and digestion and things like that. So the primary internal condition right now is really abnormal body composition. What do we mean by that? That is too much fat, not enough muscle. When we have that, it leads to too much inflammation, too much toxins being built up in the body, and usually a rise in blood sugar. And all of these, over a period of time, again lead to tissue damage that will lead to many secondary internal conditions, such as heart disease, strokes, diabetes, certain cancers, hormone imbalance, high blood pressure, high triglycerides, the list goes on and on. These problems are many times treated medically, but if we can really help people, which we do, improve the primary internal condition, which is abnormal body composition, then we can really decrease the chances of you develop these secondary medical conditions, okay? So our goal really is, number one, to get you feeling better as fast as you can, so like we said, we can restore you to your normal daily activities and your normal family life. But number two, we want to teach you and help you correct the primary structural condition and the primary internal condition. And by doing that, now we can really decrease, number one, the amount of recurrences that occur, number two, the amount of degeneration that occurs in your joints and in your spine and in all the joints of your body, and also decrease the amount of degeneration in your organs and glands and tissues inside the body. So if we can do that, then we really, in the long term, increase your quality of life for a longer period of time. And that's really the ultimate goal of healthcare. All the other things that are being done are really to treat sickness. See, we have a sick care model, not a healthcare model. And our goal is to provide a natural healthcare model so that you can stay out of this very expensive sick care system, okay? So hopefully that clears up what our goals are for you. And if that's something that you find that you really want to try to change, then I think you're in the right place and we'll be able to help you. So what we'll do now is you'll probably hear from a few of our patients that'll give you an idea of what they thought of the care that they've received in our office. I want to thank you for this time listening to me, and I hope that we'll be able to help you here in the not too distant future. Thank you very much.